If you're a man over 30 and you're feeling weaker, more tired, less motivated, or struggling with belly fat, there's a chance your testosterone levels are quietly dropping faster than you think. And the scary part, most men don't notice the signs until it's already affecting their energy, mood, performance, and long-term health. Today on Vitanic Bloom, we're breaking down the 10 subtle signs your testosterone might be too low, what causes it, whether testosterone therapy is safe, and natural ways to boost your levels without pills or injections. And trust me, most men never hear half of what I'm about to share. Let's get into what testosterone actually is, because most people only connect it to muscle, gym brothers, or aggression, but it's way more important than that. Testosterone is the primary male sex hormone, and it controls everything from muscle growth and bone strength to your mood, energy, and reproductive health. Teenagers produce up to 30 times more testosterone during puberty, and then after age 30, levels naturally drop by about 1% every year. That might sound small, but over time it's enough to change how you feel, how you look, and even how your mind works. Here's how testosterone works in your body. Your brain sends signals to the pituitary gland, which then tells the testes to produce testosterone. When the levels are too high, your brain signals it to slow down. When they're too low, it tells your body to make more unless something is interfering with that system. And that's when symptoms start showing up. So let's talk about the signs. Your testosterone levels may be lower than they should be. The first sign is a noticeable drop in your sex drive. It's normal for libido to change with age, but men with low testosterone often experience a much more dramatic decrease, not just occasionally, but consistently. The second sign is difficulty with erections. Testosterone doesn't directly cause an erection, but it's needed to trigger nitric oxide in the brain, which starts the process. When your levels are low, getting or keeping an erection becomes harder, even if everything else seems normal. Third, you may notice lower semen volume. Testosterone helps produce semen, so if your levels are down, the amount of fluid during ejaculation may drop as well. A fourth sign is hair loss, not just on your head, but on your body and face. Balding can be genetic, but low testosterone can lead to thinning hair in places you never expected. The fifth sign is fatigue, not normal tiredness, but a constant lack of energy, even after a full night's sleep. Men with low testosterone often describe it as dragging through the day or feeling mentally foggy. Number 6 is loss of muscle mass. Testosterone helps build and maintain muscle, so when it drops, your strength and muscle tone may decline even if your workouts stay the same. The 7th sign is increased body fat, especially around the chest and belly. Sometimes men develop gynecomastia, or enlarged breast tissue, when testosterone and estrogen become imbalanced. The 8th sign is decreased bone density. Low testosterone increases the risk of fractures and osteoporosis as men age, even if they appear healthy. Number 9 is mood changes and mental decline. Low testosterone can lead to depression, irritability, low motivation, and trouble focusing. And because testosterone supports memory, some men experience more forgetfulness as levels drop. The 10th sign is low blood counts. Research has shown that low testosterone is linked to anemia. When testosterone gel was given to anemic men with low levels, their blood counts improved more than those who took only a placebo. So what causes low testosterone besides normal aging? Several things. Injury to the testicles, pituitary disorders, chemotherapy, radiation, chronic inflammatory conditions, HIV, testicular tumors, or long-term illnesses can all affect testosterone production. If testosterone gets too low, men may develop which can lead to infertility, severe fatigue, loss of strength, low libido, and serious long-term health issues. This brings up a big question. Should men take testosterone replacement therapy? TRT can help men who truly have hypogonadism or significantly low levels, but it isn't risk-free. Short-term, it can cause acne, sleep apnea, enlarged breasts, and shrinking of the testicles. Long-term, it may increase the risk of heart problems like heart attacks, strokes, and cardiovascular disease. There's also a concern that TRT could stimulate prostate cancer cells. That's why you should always consult a healthcare provider first and get proper testing before even considering therapy. Now, what about natural ways to raise testosterone? Thankfully, there are options. Zinc is a big one. Studies show zinc plays a major role in regulating testosterone. Foods like shellfish, whole grains, and nuts can help. Potassium is important too because it supports testosterone synthesis. Bananas, spinach, and beets are great natural sources, and lifestyle changes matter just as much as supplements. Regular physical activity, especially strength training, improving sleep, reducing stress, and maintaining a healthy weight can all help support natural testosterone production. So that's your complete breakdown of testosterone. The signs of low levels, the causes, the risks of treatment, and simple, natural ways to support healthy hormone levels. If you're noticing several of these symptoms, it might be worth getting your testosterone checked by a medical professional. And if you want more science-backed health guides like this, make sure you resubscribe to Vitanic Bloom. Let me know in the comments if you've ever tried testosterone boosters, or if you like a follow-up video on how testosterone affects women too. Thanks for watching, and stay healthy.